Research is showing minority communities are being hurt more by COVID-19, and I'm joined by Sarah Lewis, the Vice President of Health Equity at Hartford HealthCare. Thank you for being with us.
Thank you.
So tell us about the data we're seeing here in Connecticut and elsewhere that shows that there are more positive COVID cases and higher mortality rates among Black and Hispanic populations.
Yes, unfortunately, we are seeing a higher positive COVID rate among our Black and Hispanic neighbors here in Connecticut. It's much higher than that for white residents of the state, and unfortunately, the mortality rate, the crude mortality rate, is highest for Black residents of Connecticut as well. And across the country, we are seeing these sorts of disparities emerge. The overall rate that some of the data from the CDC is indicating is an 18% death rate, weighted distribution death rate for African Americans across the country, when African Americans only make up about 12% of the population overall. And for Hispanic residents, it's 26% as opposed to 16% in terms of population overall.
Do we know why?
Well, you know, the thing is that the virus is new, but the underlying sort of socioeconomic and societal inequities are not. And so we could predict it, unfortunately, that the virus would break along these lines, especially given the way that it's transmitted and that people who are in close contact with one another, people who are on the front lines of our economy, working not just in healthcare, but in retail and other industries where people come into contact with other humans on a regular basis, people who take public transportation, people who live in more densely populated areas are more likely to be exposed and don't have the opportunity to work from home or shelter in place because they need to go out and make a living.
So testing is crucial, and tell us finally how you've ramped this up. So basically anyone can get tested. That is the message right now.
It is, and I'm really proud of my colleagues at Hartford HealthCare. We've pivoted our operations so that we can not just offer testing through our drive-through centers, but mobile testing. It's essential that we meet people where they are when it comes to the testing that we all know we need in order to feel safe to go back out into the community right now.
Thank you, Sarah Lewis, for the information. Thank you so much for being with us.
My pleasure. Thank you.